When trying to get pregnant, there are a lot of things you need to do in order to maximize your chances of getting pregnant. Some couples have tried and they have taken a longer time than expected. Why? What is happening? So stay tuned to this video. Today we are going to talk about the tips in which you can get pregnant faster, what you have to do before getting pregnant. Does the style of sexual intercourse, does it matter? And when is it important to visit a doctor before you can say there is a problem? So stay tuned to the end of this video and listen to everything. Welcome back to Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. So if you're new to this channel, please click the subscription button such that you're going to receive tips on women and pregnancy advice weekly. To those who have subscribed, thank you very much. You're always welcome back. So today we're talking about the tips on how you can get pregnant fast. What are the things necessary if you want to get pregnant? What do you have to do in order to maximize your chances of getting pregnant fast? And does the style that you use, does it matter? And when do you need to consult your doctor if there is no pregnancy? So we're going to start. First thing we should know is that what is infertility? Infertility is a condition in which a couple cannot get pregnant within 1 year of regular sexual intercourse. We are going to come to that. So the man or the woman, if they are considered healthy, if they are considered fine, they have a 25% of this couple getting pregnant in the month they plan to get pregnant. There are things that we need to take into consideration before trying to get pregnant. So what are the tips we need to know? The first tip is your cycle. Do you know your cycle so well? How well do you know your fertile period? So during the fertile period, what you need to do is you need to have regular sexual intercourse. What do I mean? One time every 48 hours. That's one time every after 1 day. So that's what we talk of regular sexual intercourse during the fertile period. You see that a problem might come in when the man might have traveled or they are not living together, they are living in different towns. So here we cannot really have this regular intercourse. So what happens in this kind of cases, it's always good to know your fertile period and your ovulation day properly. So I made a video on how you can calculate your ovulation, your fertile period, even people with regular cycles and in those with irregular cycles. Secondly, you should make sure you're in good health. For example, if you've had a history of sexually transmitted infections, fibroids, as for the woman, and the man has had a history of mumps, surgery to the testes or to the penis, if there's any of these, you should make sure that if you have tried getting pregnant for at least 6 months, it's always good to consult your doctor. Also, if you have any medical condition where you're taking medications, let's say high blood pressure, diabetes, epilepsy, if you're taking any of these medications daily, you need to consult your doctor because there are some drugs that you're taking which are not compatible with pregnancy. So it's good that you consult and these medications are changed before you take in. So it's very important with good health, you need to take care of these conditions before you decide to take it. Next is age. Age matters a lot. There's an increased rate of infertility because men are now getting into the career field where they tend to go to school, and before they want to start getting pregnant, age might have caught them already. So with age less than 35 years old, if you're trying to conceive for at least 1 year, 1 year of regular sexual intercourse. When we talk of regular sexual intercourse, that means 2 to 3 times per week. That's when we say there is a problem, or when we talk about infertility. So now, Women who are above 35 years old but less than 40 years, if they have been trying regularly for at least 6 months, it's good, and no pregnancy, you consult your doctor at that time. Lastly, women above 40 years of age, before they want to take in, make sure you consult your doctor. Your prenatal vitamins are very important, which consist of folic acid. So it is important you take folic acid of 400 micrograms daily. That's 1 month before you even think of getting pregnant. What does it do? What's the importance of this folic acid? This folic acid helps to prevent a birth defect called the neural tube defect, and these are abnormalities which occur at the level of the spinal cord. In this kind of babies, it can make them not to be able to walk, affect even urination depending on the level or the degree of the spinal cord defect. So if you want to get pregnant, you take a prenatal vitamins which contains folic acid of 400 micrograms daily for at least a period of 1 month before you take in. Now, for a healthy lifestyle, it's very important we have a healthy lifestyle. What do I mean by that? No alcohol, no smoking, and no drug taking. So these ones are proven to cause birth defects to the children. Then you can reduce your level of caffeine. We know that people that really live a lot on this caffeine. So if they cannot stop it completely, you can reduce it to at least 2 cups a day. So it is very important we take this, because caffeine has been linked to miscarriages. So it's important you reduce the rate at which you take caffeine. Eat healthy diets. Healthy diets are fruit, vegetables, then even the fatty foods. You can take natural fats like avocados. So these ones really help you. Also, regular exercise is needed. You can take regular exercise in order to also have a good weight. So you need to maximize you need to have a good weight. And good weight, what do we mean by good weight? That's when your body mass index is between 18.5 to less than 25. So if you have a body mass index within this range, that means you are a good weight. So there are some myths which people use. They say the position on which you had sexual intercourse matters. But I am here to tell you that it is just a myth. It does not matter. And what just matters is if the man is able to ejaculate inside the woman. That is all. So you don't have to say, no, this position, no, the one which is comfortable for you. Once the man has ejaculated into the woman, then there is a possibility of pregnancy. And the number of times which you need to have sexual intercourse during your ovulation day, it does not matter. Even just one ejaculation can cause pregnancy. Even though the number of times, the more frequent you have sexual intercourse during ovulation day, can increase the number of sperm reaching. It might just increase the rate, but it does not rule out the fact that just one ejaculation or just one time during your ovulation day, you can get pregnant. Then there are some women who say when they have, after sexual intercourse, they have to lie down so that the sperm can go up. No. Once the sperm has been ejaculated, we said the sperm swim. They swim and they just take minutes to reach up and locate where the fallopian tube is. So if it has the right speed and sperms are okay, whether you lie or you wash your vagina as much as possible, it does not change anything. So position does not matter. The way you lie, and you lying in bed and wanting the sperm to go up, it does not matter. And the number of times, it might just increase the chance, but it does not rule out the fact that just one ejaculation or just one time during your ovulation day can make you get pregnant. So please, if this was helpful, give a thumbs up to our video, and if you want us to discuss about any other thing, you can drop it on the comment section. We can even use it to make a video. So if you want a private consultation with me, you can click on the link below and get to me. Let us discuss more. So thank you very much. God bless you.